Everyone, welcome to Learning Surgery. Today we'll discuss the phases of wound healing. So, what is a wound? A wound is basically a breakdown in tissue continuity, and it can occur because of various reasons. It can occur because of trauma. It can be caused by surgical surgery, such as surgical incisions, and it can result from burns. Like there are numerous causes to it. So what happens after wounding occurs? So when wound occurs, the process of wound healing is set forth into action. So the wound healing process, it has four phases. So there's hemostasis, and there's inflammatory phase, there's proliferative phase, and the final stage is the remodeling phase. What happens during hemostasis? I'm going to try to pinpoint important points related to it, like which cells predominate in which phase. So if we talk about the hemostatic phase, during this phase, platelets are the cells that predominate the this phase. So during this phase, when wounding occurs and capillaries they are damaged, so the coagulation cascade is activated by fibrinogen, and there's formation of platelet plugs, and ultimately clot formation occur. The platelets, when they're activated, they also release several pro-inflammatory mediators, such as transforming growth factor beta, as well as platelet growth factor, and these serve as chemotatic factors, and they draw neutrophils to the wound site. So the major player during the hemostatic phase is basically platelets. The second phase is inflammatory phase. This lasts up to 48 hours. Now, major player in this phase, major players are neutrophils, macrophages. So what happens? The various chemotative factors that are released, the activation of complement, which ultimately leads to formation of the C3A, C5A, along with the bacteria. They all cause the neutrophil. They all serve as chemotatic signals for neutrophils, which then come to the wound site. The neutrophils then they phagocytose the debris, the foreign bodies, and they also, after neutrophils, monocytes, they come into the site of wound and wound healing, and they then form macrophages. Now, what happens when the macrophages come in? Macrophages, they also release certain pro-inflammatory mediators. Um, it's tumor necrosis factor alpha and interleukin 1. So these two factors, what they do is that they attract fibroblast to the site of the wound. So fibroblasts, they take part in wound healing. They lay down collagen and form the extracellular matrix. They play a very important part in wound healing. So macrophages, they basically attract fibroblasts to the wound site. So if macrophages are deficient, like in certain conditions, then abnormal wound healing will occur. So that is what you have to keep in mind. The third phase is the proliferative phase. Okay, during this phase, angiogenesis occurs, and there is formation of granulation tissue, and the fibroblasts, they lay down the extracellular matrix material, and the fibroblasts, they eventually transform to myofibroblast, which then contracts and brings the wound edges together. So angiogenesis occur because of the hypoxic status of the tissue. Various factors, they are produced, which draws the process of angiogenesis to occur. And the fibroblast, they release they form the extracellular matrix material, and they lay down collagen. And so the collagen, so this leads to formation of granulation tissue. Granular tissue is connective tissue with blood vessels, with underlying blood vessels, and ultimately the fibroblast, they mature and they form in myofibroblast, and the myofibroblast, they contract and bring the wound edges together. So the major player again within this phase is fibroblast. It's a major player. This phase lasts from 3 to 10 days, the proliferative phase. And during this phase also, the keratinocyte, they migrate from the wound edges, and an epithelial surface is formed over the surface on the wound. So there's angiogenesis, there's formation of epithelial surface, there is formation of a granulation tissue, and wound contracture. These things occurs. The final phase is the remodeling phase, and this phase lasts from 2 weeks up to years. And during this phase, what happens is that the cellular content, it decreases due to process of apoptosis, and the extracellular matrix content, it increases. The collagen, it is converted in from type 3 to the stronger type 1 by matrix metalloproteases. So matrix metalloproteases, they basically convert collagen type 3 to type 1, which is stronger. And but the wound, it never gains its strength, normal strength. At maximum, it reaches 80% of the normal wound strength. And then what happens is this process will continue up, can continue up to years as well. Um, the so basically the scar, it consists of normal tissue components, but the proportion of the macromolecules is different from the normal tissue. And one more important point over here is that uh, in individuals where hypertrophic scar form, or in abnormalities where there is formation of hypertrophic scarring, there's one important player that takes part into it, because of which it occurs. It's transforming growth factor beta 1. This is the major player in formation of hypertrophic scar. So I've actually tried to summarize the important details. So again, quickly going through it, in hemostasis, predominant cell is platelets. Simple clot formation occurs, and the chemotatic process, it comes into action. Next is inflammatory phase, where the WBCs, neutrophils, and macrophages, they're the predominant cell types. And the macrophages, it causes the fibroblasts, release factors, TNF alpha and interleukin 1, which causes the fibroblasts to enter into the wound. And then during the proliferative phase, there's angiogenesis. Because of the hypoxic status of the tissue, various factors are released, which causes the process of angiogenesis. And then the fibroblasts, they lay down extracellular matrix material, and this leads to formation of granulation tissue, which simply consists of connective tissue with blood vessels. And the fibroblasts, they form, differentiate into myofibroblast, which causes contraction of the which brings the wound edges together and causes wound contraction. Last phase is the remodeling phase, and this phase lasts from 2 weeks to several years. During this phase, the cellular content decreases, and the extracellular matrix content increases, and type 3 collagen is converted into type 2 collagen by matrix metalloproteinases, and ultimately wound healing occurs. Scar tissue consists of nothing but normal extracellular matrix material, but the macromolecules are in abnormal proportion to each other. And the major factor in implicated in formation of hypertrophic scar is transforming growth factor beta 1. So that's it for today. If you guys have any questions, they can drop it in the comment section. Thank you for watching my video. Take care. Bye.